As the number of procedures being performed is increasing, there's not surprisingly an increasing number of injuries that are occurring as well. From 1985 to 2012, there's been an increase in litigation related to injuries stemming from cutaneous laser surgery. What's interesting related to this is that a majority of the cases more recently have been performed by non-physician operators, particularly non-physician operators who are practicing outside of a traditional medical setting. In fact, about 75% of the cases from 2008 to 2012 were performed by non-physician operators who are practicing in a medical spa. And if you look at all the medical spa cases taken together, about 50% of them are ones in which a non-physician operator was performing a procedure without proper physician supervision or even a physician supervisor identified. This to us suggests that there may be some inherent risk to this practice. Of the 175 cases we looked at, by far the most common reason we found for there to be a legal action was the failure to obtain a proper informed consent. And we found this to be true in about a third of the cases. In fact, there's numerous things that go into obtaining a proper informed consent. You must discuss the risks, benefits, and alternatives of the procedure prior to performing the procedure on a patient, and the information must be presented in such a way to a patient that it's understandable, not in medical language, but in layman's terms. And also the specific risks to this particular patient as it relates to a specific procedure must be elaborated. It also helps set expectations for a procedure, and this is one of the single things you can do to help prevent a lawsuit. As more and more of these procedures are being performed, the state laws are constantly evolving, particularly as it relates to delegation, supervision, and training requirements that are required. I think practitioners who are providing these services should be aware of the laws in their particular jurisdiction, particularly as they're constantly changing. In regards to HIPAA, as we move more and more towards a digital age, it's important that people who are storing patient-related information on devices such as jump drives, smartphones, and tablets have these devices encrypted in order to prevent inadvertent access should the device be misplaced or stolen.